Today we're going to be looking at the scalars. So I want you to go ahead and take a look in your cassette and locate the anterior sickle scalar. It's going to look like this instrument that I'm holding here. It has two working ends. They are mirrored. It has a straight, simple shank, and the tip of the working end comes to a point. So that is going to be your visual cues to see and identify the anterior sickle scalar. So it's going to look like this. The other instrument that we're going to be looking at today is going to be the posterior sickle scalar, which looks a little bit different. So it's also going to be double-ended. It has two working ends. They are mirrored to each other. And then the biggest difference here that we can see that can identify if it's a posterior or anterior is going to be the shank. This shank is a little more complex, meaning it has a little bit more bends. So that's going to tell you that that is a posterior instrument. And then also when we take a look at the working end, you can see that it comes to a point, to a tip. It has two parallel cutting edges similar to the anterior sickle scalar. So if we look at both of these instruments together, you can see that one is a little bit more complex or has more bends in the shank, and one is more straight. So the straight one is going to be used in the anterior, and the more complex shank instrument here that has more bends is going to be used in the posterior. So those are the two instruments that we're going to look at today. First, we'll start with the anterior sickle scalar. So we really want to make sure that we establish a nice modified pen grasp. Our handle is going to be resting in this area here. And then our thumb and our index finger are going to be opposite each other with some space on the handles separating them. And then our middle finger is going to extend in front of that index finger. You can come down and have that middle finger rest lightly on the shank, and then we'll reach out or extend our fulcrum finger here so that we can create a nice stable fulcrum. So with the anterior sickle scalars, we are going to be using the towards and away surfaces. So sitting at 9 or 3 o'clock, 9 o'clock for right-handed operators, 3 o'clock for left-handed operators, we're going to be approaching the towards surfaces. So I'm going to scooch this down a little so you could see. Now, important to remember again that we have two cutting edges. So these cutting edges are parallel to each other. So we're going to use one side for the toward surfaces, and then we'll use the other cutting edge for the away surfaces. So first we're going to insert at the midline. You want to use only the side of the tip third. We never want to adapt the straight tip onto the teeth. That can create some damage. So we only want to use the side of the tip third. And then we're going to insert at the midline. And what we want to do is we want to avoid laying it flat on the tooth. We want to create more of a 70 to 80 degree angle. So if I roll that tip towards the tooth, it's going to create a 70 to 80 degree angle from the cutting edge to the tooth surface. So that's the angle we're creating. So we don't want to start straight on the tooth. We want to start kind of rolled in, tilting that tip towards the tooth there. So I'm going to go ahead and insert at the midline, and I'm going to start rocking. We're going to create some nice short strokes. These are supragingival calculus removal strokes. Once I hit that line angle, I'm really going to need to start rolling within my grasp, and then I'm going to roll all the way to the distal, creating more vertical strokes. So when we're starting at this midline, rolling towards the tooth to create that angulation, we're creating more oblique strokes on the facial and lingual surfaces. But once we start rolling, once we hit that line angle going into the interproximal surfaces, we're creating more vertical strokes. Remember, these are short strokes, and these are going to be removing calculus on the supracoronal surfaces of the teeth. So if I go down to the lower anterior, sextant 5, I can use the same end, or I can flip ends. So as far as identifying which end to use for the anterior, this is probably our easiest instrument because you can adapt both ends and you don't necessarily need to identify the correct end. Because the shank is straight, it can adapt onto those toward surfaces and away surfaces without really having to switch the ends. So I'm going to go ahead and come down to the lower anterior sextant 5 facial. So now I'm still at about a 9 o'clock, 8 to 9 o'clock down here. I'm coming up on my fulcrum, so you can see how the instrument is really coming, is in the same direction of the lower anterior teeth. I've created a nice modified pen grasp. My middle finger is resting lightly on the shank. My fulcrum is on the incisal edges, so that I can have a nice strong fulcrum, and I'm up on my fulcrum. So I'm not laying down, I'm not on the side, I'm really up on my fulcrum so I can really get that instrument in line with the teeth. So go ahead and adjust my grasp there. So I'm also going to insert at the midline, similar to how we instrumented or use the Explorer. So I'm going to go ahead and go to the midline, and if I'm flat on the tooth, that's incorrect. I want to roll slightly towards the tooth to create that 70 to 80 degree angle from the cutting edge to the tooth surface. So I'm in position here, starting at the midline. I have my 70 to 80 degree angle. I'm rocking, creating some nice oblique strokes, and then I'm pivoting as I come to the distal, and then I'm creating more of a vertical stroke. So again, short strokes, vertical in the mesial and distal surfaces, more oblique when we're on the facial and lingual surfaces. So similar to the Explorer, we're going to divide our anterior teeth in towards and away surfaces. Now we're going to look at the 204S, which is our posterior sickle scalar. So again, it looks like this here. It has more of a complex shank. It's going to have a pointed tip. It has 2 parallel cutting edges. And we're going to now with this posterior instrument, we really need to identify the correct working end, because this is not going to be like the anterior sickle scalar where we can adapt both ends. So I'm going to go ahead and retract for my sextant 6 buckle here, and let me zoom in so we can see just a little bit better. So if I go ahead and, whoa, don't do that. I'm going to go ahead and create a nice modified pen grasp, and I'm going to go ahead and adapt the tooth or the instrument to the tooth. And you can see that my V here, that terminal shank meets that functional shank. It creates a little V. It's pointed towards the distal. My functional shank is coming up and over the tooth. So that tells me that's the correct end. So if we switch ends, we can see that if I try to adapt it to the distal of these posterior teeth, it's going to wrap, and that V is going to be pointed towards the mesial. So this is an incorrect working end. So we'll go ahead and adapt the correct working end. And we're going to use the inner cutting edge for the distals, and then this outer cutting edge is going to be used for the buccal and lingual surfaces and also the mesial. So we're going to start on that inner cutting edge. The point is pointed towards the distal. I'm going to insert at the distal line angle. I'm going to roll towards the tooth to create that 70 to 80 degree angulation of the tip third, and then I'm going to start rocking and rolling all the way to the distal. When I'm on those distal surfaces, I'm creating more of a vertical stroke. When I'm on the buccal and lingual surfaces, I'm creating a more of a oblique stroke. So again, you can take a look inside to the in the mirror and use some indirect vision there. I have the tip third adapted to the distal line angle, roll it in towards the tooth to create that 70 to 80 degrees, start rocking and rolling towards the distal, and then I have to pivot up as I reach that distal surface to keep my terminal shank parallel to the long axis. So now I'm going to use the outer cutting edge. I'm going to really come up on my fulcrum here so I could get that outer cutting edge. I'm also going to roll a little bit in my grasp, adapt that outer cutting edge, tip third to the mesial, or excuse me, to the distal line angle. And now I'm going to be coming across the buckle using the tip third, rolling. Once I hit that line angle, I'm really going to need to start rolling, and then my pivot's going to start coming down on my fulcrum so that I can create that parallelism with my terminal shank. So let's do that one more time. So I'm going to use my inner cutting edge, tip third. See if I can get this in the mirror for you. You're going to insert at that distal line angle. I'm going to roll towards the tooth to create that 70 to 80 degree angulation, rock and roll, pivoting up as I come to the distal, creating some vertical strokes as I get to that distal. Then I'm going to come out. I'm going to come up on my fulcrum. I'm going to use the outer cutting edge now, starting back at that distal line angle. Now my tip is pointed towards the mesial. And now I'm going to come across using the side of the tip third. I have my 70 to 80 degree angulation. I'm going to start rolling, coming down on my fulcrum, coming to the mesial, creating some nice vertical strokes as I get to the mesial. So if I want to switch and go to the maxillary arch, I can try to use the same working end. And once I adapt my fulcrum and my modified pen grasp, I can go ahead and place my instrument on the distal surface there. And I can see that my working end is wrapping and my shank is coming across the crown of the tooth. So that means that I'm using the incorrect working end. So to adjust that, I'm going to switch ends. Now I'm going to adapt to the distal surface. I can see that my terminal shank is parallel to the long axis of the tooth, and my functional shank is coming down and out of the mouth. So you can see that in the mirror as well. So I'm going to go ahead and start at that distal line angle using that inner cutting edge. I'm going to create that 70 to 80 degree angulation. So I'm going to roll towards the tooth. So that cutting edge and the tooth surface has a 70 to 80 degree angulation. I've adapted the tip third. I'm going to start rocking and rolling, and pivoting towards that distal. Now I'm going to come out. I'm going to use the outer cutting edge, coming back to the distal line angle, using the tip third, roll towards the tooth to create that angulation of 70 to 80 degrees. Start rocking and rolling, and pivoting as I come along to the mesial. So that is how do you adapt the sickle scaler to the posterior teeth and the sickle scaler to the anterior teeth. So remember, we're looking at two different instruments, one for the anterior and one for the posterior. We'll be working more in clinic and connecting with you to create some more demos. Utilize this video to practice at home with your typodont and practice your technique. Remember, anterior, we're using towards and away. Posterior, we're using that distal line angle to the distal and then distal line angle to the mesial.